Welcome back, guys. My name is Dr. Lane Tran at Fast Hand Sports Therapy, and today we are going over part 2 of tissue injuries in the knee. So today we're going over passive stabilizers, and what that means is passive stabilizers are essentially ligaments, joint capsules, retinaculums, anything that you don't have to consciously think of to contract to stabilize a certain area. So let's dive right into it. So if you dive into the knees right here, some passive structures that may be injured is one is the joint capsule. So the joint capsule here, as you can see, is essentially pretty much encompassing the entire knee joint. What the joint capsule does is it holds synovial fluid and it adds stability to the knee as well. So primarily, rotational stability gets taken up by the joint capsule. So this is one structure that may be injured. If we go to the outside of the knee here, the outside, a couple ligaments. So the LCL is a general structure that may be injured. And also in the medial compartment here, you have the MCL that can also be injured. Now, if we dive a little deeper on the knee on the patient's left here, or your right, what you can see here, I took some of these structures away to make it easier to visualize what's inside the knee. So inside the knee, if you rotate around here, we have the PCL right here. So the PCL, as you can see right here, this is the front of the knee, this is the back of the knee. The PCL limits the amount of translation or limits the amount of movement of the tibia sliding backwards. So it stops the knee from sliding, or stops the tibia or shin bone from sliding backwards. That's another structure that may be injured. And then if you go around here, there's another small one in here. So this ligament right here is your ACL. You'll hear about a lot of injuries. So the ACL here, as you can see from the femur down to the tibia, or your thigh bone down to your shin bone, it limits the amount of translation forward. So the amount of shear forces going forward on the tibia or your shin bone. So it prevents it from sliding forward. So those are two more structures that can be injured. Now, if you look at top here, we have these two C-shaped structures here. So these are your meniscus. So your meniscus here is also a structure that will be injured. Usually when you feel that popping, clicking that's associated with pain, it doesn't always have to have pain in there, but that clicking and popping sensation in your knee that you feel may be linked to your meniscus. Whenever that knee is bending and sliding, these grooves right here slide on top of the meniscus. They may essentially pin down or essentially rip meniscus, causing a little bit of flap tears in the meniscus here and there. It's another structure to be injured. So that right there, guys, is a quick gist of soft tissue structures that most likely may be injured in climbers for performing a heel hook, specifically passive stabilizers. Again, these are not all the structures that may be injured. There's a lot more in there, but these are the general structures that may be injured. Coming soon will be a video on how these structures are injured when performing heel hook, and I'll explain to you guys more in depth on how to prevent those in the future. If you have any questions, feel free to text, guys. Feel free to call, send an email or a message. I'm always here and always welcome to help you guys out. Please feel free to reach out at any point in time. Have a great day, guys.